Hi all. Today we are going to discuss OBG Unit 4 Pelvic Inflammatory Disease PID. Okay. So what is pelvic inflammatory disease? It is an infection which is usually seen in female reproductive organ. Okay. That's why I have asked you to refer the anatomy and physiology of female reproductive system. Okay. So pelvic inflammatory disease is an infection caused by a bacteria through sexually. Okay. So we can say it is a sexually transmitted bacteria, okay, from your vagina. That infection is spreading to the uterus, fallopian tubes and ovaries. Okay. So definition is clear. Next we are going to deal with the etiology. As I already said, it is a bacterial infection. Example, we can say that gonorrhea, chlamydia infection. Okay. Then insertion of IUD, since long copper T is inserted, like it's an outside device which is inserted to prevent pregnancy, right? So if for long years, around more than 5 to 7 years and all, if that copper T is inserted, that itself will cause an infection. Okay. Then if there is a recurrent miscarriage, okay, abortion or MTP, medical terminal pregnancy, okay, this all are the causes of etiological causes of pelvic inflammatory disease. Okay. And we can say risk factors using multiple sexual partners. Okay. Using of if you are inserting an IUD recently, okay, it's an outsider device. When it comes to our body, the body automatically gets affected, right? The body reacts to it. Then if there is a history of PID, that is pelvic inflammatory disease, or if there is a history of sexually transmitted disease, AIDS, okay, then being sexually active woman younger than 25 years, the woman who is younger than 25 years, they are more prone to get pelvic inflammatory disease. Okay, see, this diseases and all, usually they won't go for treatment. They don't seek any advices because there is no signs and symptoms in the starting stage unless and until they go for a pregnancy, okay, treatment, because delayed pregnancy is happening. And if it and the chronic stage, when the pelvic is getting infected, they will be having pelvic pain. At that time only they will be seeking treatment. At the early stage they won't be taking any treatment because there is no signs and symptoms. Fine. So later the signs and symptoms will be like there will be pain in the lower abdomen, okay, heavy vaginal bleeding will be there with a unpleasant odor, irregular menstrual bleeding. As it is an infection, fever, chills and malaise will be there for the patient. Painful micturition, dysuria, pyuria will be there for the patient. And also while intercourse also the pain will be very much high. The person will not be able to have a sexual pleasure. Fine. Then pelvic inflammatory disease cause only mild signs and symptoms, okay, especially if it is a chlamydial infection. Okay. Then diagnostic evaluation, history collection, physical examination will be done, pelvic examination will be done. During pelvic examination, what do they do is like pap smear will be done for the patient. Okay. Then they will collect the sample from the cervix and vagina to know what is the cause of infection. Okay, it can be a bacterial infection, it can be chlamydial infection, right? So we have to know the cause of infection. So from the cervix they will be taking some samples of that white discharge. Okay, urine test will be done because the person is having dysuria, pyuria and all, right? Now to confirm the diagnosis, we will be doing ultrasound. Okay, biopsy will be taken from that particular part. Okay, endometrial biopsy, ultrasound and laparoscopy, visualization. Okay, so these are the diagnostic evaluation. Moving on to the management, this bacterial infection, antibiotics will be given for the patient. Okay, antibiotic treatment help to prevent serious complication for the patients. But if there is any wound, okay, or if there is any damage happen, that won't be reversible. Okay, it just treat the disease. Fine. Antibiotic treatment can prevent the serious complication, okay, but cannot reverse any damage. Okay, an antibiotic will be given either intravenously or orally. Fine. Then As we said in the risk factors, it is also seen in multiple sexual partners, okay, and also between sex partners also this is seen, right? So what we have to do is we have to give the treatment for the partner also, okay, to prevent the reinfection. This infection can occur recurrently. So to prevent the reinfection, what we have to do is like the woman should get treated. The same time, the partner should also get treatmented or get treated to reduce the reinfection. Okay, to prevent reinfection with sexually transmitted disease, advise the partner to get examined and treated. Okay, so that because the woman is only showing signs and symptoms, but the infection will be with the partner. So, but that person will not be having any signs and symptoms. For that, we have to take a treatment. Then next one is temporary abstinence. Abstinence means stoppage or avoiding sexual intercourse until the treatment course is completed. Okay, so that there won't be any infection seen again. There won't be any major surgery done for pelvic inflammatory diseases, but usually what we do is like, if sometimes, okay, if there is any abscess means pus collection, okay, seen and all, so in that time what we do is we will do a IND, incision and drainage, okay. Then this incision and drainage is also done in a rarest case where the woman is not responding to oral antibiotic or intravenous parenteral route antibiotics. Okay. Now, what are the complications of pelvic inflammatory diseases? If pelvic inflammatory disease is left untreated, okay, there will be scar in the tissue, abscess in the fallopian tube. As I already discussed in the definition, the infection from vagina, it is going on to the uterus, fallopian tubes and ovaries, right? So, there will be damage in the reproductive organ. Ectopic pregnancy. Ectopic pregnancy means what? The ovum and the sperm is getting fused in other than uterus, okay, anywhere other than uterus, okay, that is known as ectopic pregnancy. Infertility, then chronic pelvic pain. These all are the complications of pelvic inflammatory disease. I hope you all understood this topic. Thank you.